it's Dr. Queen again from Advanced ENT and Allergy. So people often ask, how are you going to diagnose allergies? When a patient comes to my office, what are we going to do? How are we going to find out what their allergies are? And the first thing that's going to happen is you're going to have an examination where we're going to look at your ear, nose, and throat and look for signs of allergies. We'll often see swollen nasal mucosa or mucus in your nose or post-nasal drip, looking at the tonsils if you have them, and looking at the turbinates, which are bones that come from the side of your nose that often get swollen, and some structural abnormalities that you might have in your nose, which aren't allergy but can contribute to nasal congestion as well. And then we'll talk about your symptoms. A lot of allergy diagnosis, in fact, I think most allergy diagnosis can actually be made off of the symptoms. We usually can tell whether you've got allergies just based on your symptoms. We have to prove it, but most of the time we know already that you've got allergies. It's just a question of what are you allergic to and how much. So the next thing that we'll usually do, we'll try various medications. If you haven't used some of them over the counter, there's some prescription medications that we may try as well. And if we haven't gotten the symptom control that we want, or sometimes you just don't want to take a lot of medications, you just rather try to fix the problem, then we'll usually recommend allergy testing, where we'll do usually skin testing to find out what you're allergic to. There are a few other ways you can do some forms of blood testing, but skin testing is going to be more accurate as long as you can not have a contraindication to skin testing. That's generally what we'll do. And we'll do these in the office to find out what you're allergic to. And when you come back, we'll go over the results and we'll decide, what are you allergic to? How bad is it? And how should we treat it? Should we go with immunotherapy, continue medications? Are there maybe some surgical options which might also help with your symptoms? And put together a package which is tailor-made just for you.